That means through the pulse diagnosis, we could not able to find out the large intestine, stomach and triple vulvar, small intestine, gallbladder and vesical organ. We could not able to see the pulses, is not indicating all the pulses are all the internal organs having the deficiency. Please don't assume like that, don't predict and don't say anything to the patient. Right. So now the energies are existing because the mild to moderate is BMI is normal, that indicating that reflex. When the BMI is more than 28 and then 30, that indicating the obesity. In that particular situation, we can't find the pulses. In that situation, what can be done? So is indicating all the weakness of that organs? Absolutely is not like that. But organs having the enough energy, but there is the hidden energy. How to execute? By executing, there are the two most important imperative points I wanted to tell you. One point to be known as a Chung Wan. That is, Chung means is the abdomen, Chung means is the center, Wan means is the abdomen. That is the Ren 12 point. Right. The second point to be known as a auricular 0 point. The center of the crest of the helix, you can find out in the center. So you just apply the 0 point where the solar plexus, sexual dextile and then 0 point and the stomach point. In the one line there are the 4 points. But center point you just add up as a 0 point on the auriculotherapy. Then these 2 points is quite enough. All the yang pulses will come out. If the yang pulses are not there, that will come out on the skin surface and definitely you find out the hidden pulses. Right, this is the one procedure. Later try to find out which pulses having the deficiency later. It won't come all the 6 pulses. Perhaps which is the deficiency, it shows deficiency. Which is the normal, it shows as a normal. Based on that principles, you just treat the patient accordingly. Right, number 1. Number 2 is when all the impulses having the deficiency. So that particular time you say that heart is not functioning, liver is not functioning, lungs are not functioning. Is it so? No. So aap aisa mat bolo. So then the pulses, again it is the hidden pulses. How to hidden pulses to bring back to the normal position. Again there is the point to be known as a Cham Men, that is the liver 13 point. And also you wanted to add up as a 0 point as a supplementary point. That also really will be helpful to the patient. But now whichever is the deficiency, that it shows the deficiency, the hidden pulses come out on the skin surface of the radial artery. Sometimes when the Zhang viscera and then Fu viscera, both the pulses are, there is no pulses like a dead body, but you should not say that there is a person is going to die very soon. But definitely there is the hidden pulses are there. How to execute that? But definitely there is the, if there is the Zhang Fu viscera, both the meridians, definitely there is all the 12 pulses you could not able to find out. So even that particular situation as a therapeutic point to be taken place, one single point to be treatable by using that point to be known as a, I wanted to tell you that point, please comment in the Zoom, yes or no?
Yes, sir.
You wanted to know? Please tell loudly.
Yes, sir.
Good. Then you just note down that point to be known as a Yung Chuan. Yung Chuan is the K1 point. K1 having the adrenergic point. You just activate the K1 point. That also will be really, really helpful to bring out all the hidden energies to come out. At the same time that having the therapeutic effect as well. Because that effect, because that is the earth point that is communicating to the brain. According to the TCM principle, the head, the endocrine system is not precisely functioning in our body. That time it gets the hidden energies. To execute the energy, rather than giving the DU20, better you work as a DU20 is equal to the Yung Chuan K1 point. K1 is applicable to increase the energy level, increase the blood flow to the CNS system. That's the reason better we can use K1 point. Right.